Can I have a neck lift without visible scars or open surgery?
Throughout my career, I've helped my patients with sagging neck and loss of jawline definition with different types of open surgical face and neck lift procedures. These procedures involve strategically placed incisions in front of the ears as well as behind the ears. I tend to be conservative and agree to perform these procedures when the cheeks, jowls, and sagging neck skin have descended enough to justify the surgery, the recovery time, and the expense. There are, however, categories of individuals who need better jawline definition and better neck contours who are not ideal candidates for open surgical face and neck lift procedures. One category is younger people who are in their 20s and 30s who may benefit from liposuction but also would benefit from skin tightening. Another group are middle-aged men and women who are unhappy with the sagging skin under the chin, particularly when they look downward. Additionally, there are men and women with some sagging skin in the neck and the presence of neck bands, also known as platysmal bands. Men in particular are less than ideal candidates for face and neck lift procedures due to the potential visibility of incisional scars and the displacement of sideburns and hair-bearing skin such as the beard skin. People with darker skin types are also concerned about the visibility of scars and the potential for keloids and hypertrophic scars. We've been able to help this large group of people with a minimally invasive procedure called neck contourplasty. This procedure is performed with local anesthesia and oral or IV sedation without any conventional face and neck lift incisions. In fact, the procedure is performed through small openings under each earlobe and under the chin. Unless other procedures are being performed concurrently, there are no stitches. So how is this done? The procedure involves different combinations of the following. 1. Liposculpture for unwanted areas of fat. 2. Plasma-based energy delivery to the area under the skin called Renuvion. 3. Suture support of the sagging tissue under the chin called MyElevate. Let's explore more details of this approach. If the patient has neck bands or platysmal bands, these muscle bands are divided through the skin using a special suture without having to surgically open the neck skin. This alone is remarkable. Liposculpture is then performed to reduce unwanted fat through small openings under the earlobes and under the chin while preserving a very important layer of fat directly below the skin to maintain a smooth contour. Since the skin is not being elevated and the excess skin is not being removed, we need a way for the skin to retract and define the neck. This is where I perform plasma energy delivery using Renuvion. Renuvion uses energy to contract and tighten the soft tissues under the neck skin. The skin surface temperature is not raised significantly, so injury to the skin from overheating is prevented. There is some immediate benefits with continual improvement over the next 6 to 9 months. This is particularly meaningful as I've been very unimpressed by popular skin heating devices, which have been heavily promoted for years. While these devices deliver energy to the skin in a way that can be damaging to the skin and the fat below the skin, the Renuvion device allows me to preserve and protect the skin while achieving significant results. Although the Renuvion is very effective, there is additional benefit to be derived from supporting the muscles and soft tissues under the chin. This is where I perform the MyElevate procedure. During this procedure, the MyElevate suture material is placed beneath the skin surface, between the skin and the muscle, comparable to the intended outcome of open surgery called platysmoplasty. This is particularly effective in defining the neck angle and allows the skin to stay in position when you're facing downward. This combination is what we call a neck contouroplasty. Our patients are very impressed by the results and their ability to return to work, typically in just 1 week. Neck contouroplasty is a procedure that fills a need for a large group of people who previously had limited options. Just as structural volumizing improves projection of deficiencies in bone structure, resulting in outcomes comparable to facelift surgery, neck contouroplasty is a way to help people improve the appearance of the neck and jawline in a way comparable to traditional open neck lift surgery. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.